Tanaiste, I wish to raise a matter which pertains to a constituent of mine who has since passed away. He stayed in University Hospital Limerick and was accommodated on a trolley in the corridor. After he passed away, his family were charged €813 per night. I raised it with the Minister for Health, who referred it on to the hospital, and they said the inpatient and day case charges are applied based on Section 55 of the Health Act as amended by the Health Amendment Act 2013. Now, I looked at that, and it defines charges in respect of single occupancy rooms, multiple occupancy rooms, and where overnight accommodation was not provided. Now, Tanaiste, a corridor is not a room. I'm sure as Taoiseach and in various ministries you've had to travel necessarily for work, and a room has been booked for you. I very much doubt that you were ever offered a corridor to sleep in, and if you were, that your officials paid for a room. Now, can you please confirm to this House that a corridor is not a room?
Obviously, when it comes to charges, it's a matter for the HSE and operating under Section 55 of the Health Act. Perhaps the solution for the HSE would be to not charge for the night. If somebody perhaps is in hospital, let's say for 4 or 5 days, that'd be the average length of stay in a hospital. Perhaps it would be sensible for them not to charge for the first night if the patient ends up spending that night on a trolley or a chair. But that's a decision for them to make. On the positive side, while there are still patients on trolleys every day in Ireland, a very large number are on trolleys because they're in isolation rooms, so they're on trolleys for a clinical reason rather than reasons of overcrowding. And it is positive to see that the level of overcrowding in our hospitals is at its lowest in many, many years, if not since records began. And I see that the Irish Nurses Midwives Organisation still does a daily trolley count, but has discontinued the monthly count. It used to show that X month or Y month was the worst month ever, because it's not the case anymore, and we've seen a huge reduction in overcrowding.